The health department, nonprofit groups, and CVPH Medical Center are all part of the North Country Regional Vaccination Network. It's based at CVPH and has supervised the rollout and distribution of the vaccine in 7 counties across northern New York. There's also a task force that is part of the network that's been working for several months to make sure that everyone throughout the region can get the vaccine. Dr. Wouter Rietsema with CVPH and the United Way's John Bernardi join us this week to talk about the work of the Vaccine Network and Health Equity Task Force.
Thanks for having us, Tom. The Health Equity Task Force is really focused on creating equitable access to the vaccine across all populations. So for some people, it's very easy to get the vaccine. You make your appointment, jump in your car, and go get it. Maybe you take time off from work, maybe you rearrange your schedule. But we want to make sure that hard-to-reach and hard-to-serve populations also have access to the vaccine. And there are many barriers. It's easy to take for granted some of the inconveniences that some of us face on a day-to-day basis. But for some populations, those barriers are, in some cases, insurmountable or unmanageable. And we want to make sure that hard-to-reach and hard-to-serve populations have an equitable access to the vaccine. So could be groups that are elderly, disabled people, migrant farm workers, low-income families, people that have obstacles in the way. And we want to make sure that we do everything we can to create an accessible avenue for the vaccine.
And so you, with the help of the Clinton County Health Department here in Clinton County, set up clinics in smaller communities to try to get out into some of the outlying areas to reach these folks?
Our focus from the Health Equity Task Force is to support that work in such a way that we bring, again, hard to reach and hard to serve populations to those clinics, to those opportunities. The work will continue for months and it will be a long-term process, but we're making great progress along the way.
You mentioned in some cases healthcare workers are going to people's homes. They're administering the vaccines in their homes. You mentioned the migrant workers. County health workers are going to the farms, right to the actual farms, and vaccinating the migrant workers, because we know in many cases they would be either unable or reluctant to come to a clinic to get a shot.
That's correct. There's a really, I think, impressive model that was utilized here in Clinton County early on. So this is several weeks ago, where nonprofit NAMI partnered with the Red Cross and CVPH and went out and boots on the ground, vaccinated 40 homeless people in one day by knocking on doors and offering the vaccine. There's other examples of county public health departments going to orchards and other farms to vaccinate migrant farm workers. There's examples of the county health department going to homebound elderly people who are unable to go to vaccination sites. So those are some examples, and there's many more that are occurring across the northern region of New York State.
And to cover all 7 of the rooftop counties, as you mentioned, Wouter, that takes a lot of coordination. That takes a lot of help from nonprofit groups and others in the communities to make this happen.
Yeah, that is really what in the early days, the vaccination was in a way easy, right? You just set up shop and all the people that were clamoring came to you. Now it's hard work, and what many of our health departments have identified is that when they want to go to perhaps a part of their county where there's people aren't as interested in the vaccine or they're having trouble, that they want a trusted individual. It might be someone that lives in that community. If the community they're trying to reach is people with mental illness, then NAMI is a trusted intermediary, someone to help bring people to it, to help convince people to talk to them in language that works for whatever the population is. So for migrant workers, often it might be a trusted member of the team. It might be a supervisor at the orchard who the workers all trust. Most of these workers come back year after year. So even though our health departments routinely go to these farms, they still rely on a trusted individual who can focus or function as an intermediary. And a lot of the members of the Health Equity Task Force are aware of smaller communities, either locales or groups of people, and have that connection. So that's really the work they're trying to do, is to bring those two pieces together.
And getting all these populations vaccinated is so critical, because you need to try to get as many people as possible. You've got to try to get to the magical 70%, 65, 70%. I know there's no identified number for herd immunity, but that's the goal.
Yeah, I think herd immunity is the goal. What that exactly is depends on the illness, it depends on the vaccine, it depends on a lot of things. But I think everybody pretty much believes that if we could get to 70%, we can really knock this down to little to non-existent.
Are we on our way there? How are we doing as far as the 7 counties right now?
So it varies county to county. Most of the counties in our region are above 40% fully vaccinated, and close to 50% or more in the case of some counties having had at least one dose. But as I said, that was the easy stuff. And now, where we used to focus on, the health department would do a vaccination event, they call them pods, and they'd get 200, 300, 400 people. Now a good pod might be 20 or 30 people. You go to Altona, they're probably not going to get a ton of people, but if they get 20 or 30 people, that's 20 or 30 people.
And is that what we'll be seeing for the next several months?
That is what we're going to be seeing.
And Tom, there's 2 obstacles in our way as we move forward. One of them is hesitancy. There's a segment of our population that's hesitant to get a vaccine for their own reasons, whatever they may be, and that's a challenge for us. And then the other challenge is access. Again, as Wouter put it, the people that were ready to get the vaccine were clamoring and ready to go, and most of them have had access to the vaccine. The difficulty now is either in educating and informing people with the accurate information so they can make their own decision in an accurate way, and then also creating these avenues for access. Transportation's a barrier, and there's numerous other barriers. Technology's a barrier for certain populations, transportation, employment issues in terms of taking time off from work, although we're seeing that employers are supporting more and more so their employees to go get the vaccine. Even in our little shop down the road here at United Way, a couple of my staff had asked about going to get their vaccine and do I need to put in for time? I said, no, go get the vaccine.
And are there additional steps that you'll be taking in the coming weeks, additional measures to try to reach more people? You mentioned the transportation, trying to find groups to help get people to the vaccination sites. Are there other new things you'll be trying in the coming months to try to reach as many people as you can?
There are. We're launching a fairly massive campaign, public relations and marketing campaign, which includes television, radio, print, and this is designed by and implemented by local people. So the messaging will be from local people, and we're hoping that that will have an impact. And we're also looking at the other barriers like transportation and technology. We're planning numerous initiatives around those issues. For example, technology, we're going to be setting up sites that will assist people with getting an appointment if they need an appointment. The good news there is a lot of clinics are now walk-in, and so it's an issue. You don't even need to go online and make an appointment for many of the clinics that are happening across the region. So we want to make sure that if people want that vaccine, that they can get there, and if transportation is an issue, we'll figure that out. There's numerous examples of nonprofits and volunteers that are actually transporting people to these clinics, and we're going to see more and more of that as the weeks and months go ahead.
When this rolled out, there wasn't enough vaccine for everyone. Is there more than enough vaccine now? Is that no longer an issue?
Yeah, no, there's more than enough. We started out with a supply problem We always knew that there would come a tipping point where we would shift from a supply problem to a demand problem. Because of actually success across the country, that tipping point came sooner than I think people thought. We certainly, as a country, got a lot further in the first 3 months than I think many people thought we could. So now we're in that hard to reach populations. But I was on a call with the state, and there's no supply problem. They said, if you are a vaccinating entity and you want vaccine, order it. You'll get it. There's plenty.